This morning, the White House is naming 10 historically expensive drugs that it's selected for Medicare price negotiations. The announcement is part of President Biden's ongoing plan to lower health costs across the nation, particularly when it comes to Medicare.
The efforts are also a major milestone under President Biden's Inflation Reduction Act, which was signed into law last year. The president's push to lower health care prices has received heavy criticism from both the right and the pharmaceutical industry, with some companies even going so far as to sue the federal government. Now, he's expected to speak further about the list later this afternoon. Negotiated prices are expected to go into effect in 2026. NBC News medical contributor Dr. Natalie Azar joins us now with more on this. So which medications have made the list, and is there a pattern at all in terms of what types of conditions that they treat?
Yeah, definitely. And, you know, forecasters have predicted a couple of these, and they were right about a lot of them. So there's a couple of blood thinners on there, Eliquis, Xarelto, a lot of diabetes medications, a heart failure medication. I was very happy to see two of the drugs that I use all the time, Enbrel, Stelara. Those are two biologics that are used to treat rheumatic diseases as well as psoriasis and psoriatic arthritis. So it kind of runs the spectrum. There's also a medication that treats blood cancers or hematologic malignancies. So again, 10 out of a short list of 50. Right. So it's not going to cover everything, and there won't be one on there for everyone on Medicare, but definitely I think it's names that a lot of people will recognize.
So just put in context, I mean, how big are the savings here? What does that mean for an individual and also just public health generally?
Right. So first of all, let me just start by saying that this is not a foregone, this is not a closed deal. There are going to be at least a year of negotiation between Medicare and the pharmaceutical companies who make these drugs. And we don't even know if this is actually ever going to come to fruition. But savings could be anywhere from 25 to 60% of the current amount that the drugs cost. Many of them are over $1,000 a month. And, you know, for years, Medicare beneficiaries have struggled to be able to get these medications. So certainly for them, savings will be passed on, obviously, to them, as well as their premiums and to taxpayers who are funding Medicare.
We'd like to schedule you to come back on in 2026 to talk about
Thank
this.
You,
that's how long we're talking
that's
about.
How long it could take.
People who need savings now, is there anything they can do?
Right. And so, you know, anyone who's listening to this out there who is a Medicare beneficiary knows how difficult this is with Part D. That's the medications that you get at the pharmacy. There are always patient assistance programs. Most people who are getting their medications prescribed by physicians who work in an office who have staff to do this, but it is hurdles and it's negotiations and it's using savvy, and very often it's using medications that aren't your first choice or even second choice, but going down the list to see what will be covered. And this has nothing to do with commercial insurance, by the way. This is right now just for Medicare, but we think that there might be some public shaming that could happen and that drug prices may actually go down for commercial beneficiaries, or the opposite might happen, and they might, you know, sort of, if they're thinking they're going to have you know, that they're going to be losing money in Medicare, that they might actually jack up the prices for commercial insurance. All of this is to be seen. We just don't know yet.
As our resident doctor, I mean, the potential for this, how big of a deal is it for people who need these medications?
Huge, huge. I cannot overstate how significant this would be. We have known for years that the drug companies have made so much money off of these prescription medications. The ones that they've chosen are ones that have been on the market for many, many years, not on without a generic available, et cetera. So this is going to be huge for patients if it actually happens.
All right. Dr. Natalie Azar, thanks so much for helping us understand this. We appreciate it.
Thank you.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.